Hello and welcome to Paincast, Conversations on Pain and Physiotherapy. This podcast is brought to you by the Pain Science Division of the Canadian Physiotherapy Association. I'm Tiffany, the host of Paincast and an executive member of the Pain Science Division. I practice physiotherapy in Toronto. Do you know someone who has had cancer or is currently living with cancer? What can physiotherapy do for cancer rehab and cancer-related pain management? What are some common misconceptions in cancer rehab? How do we consider the biological, psychological, and social aspects of cancer rehab? Join me in my discussion with Dr. Jenna Smith-Turchyn and Holly Edward to talk about the role of physiotherapy in this increasingly prevalent topic. Before we start, as a reminder, Paincast brings together researchers, clinicians, students, and patients to facilitate discussions, knowledge translation, and critical thinking on topics about pain and physiotherapy. The views expressed in each episode are of individual guests, do not constitute medical advice, and do not represent the views of the Pain Science Division or the Canadian Physiotherapy Association. Enjoy the episode. Good morning, Jenna and Holly. Thank you so much for coming on to the Pain Science podcast to talk about oncology rehab. Very excited about this episode. How are you doing?
Thank you.
Thanks so much for having us here today, Tiffany. All is going well.
Great. To start us off, can you introduce who you are, what you do, and what a typical week looks like for you? Maybe we'll start with Jenna.
Thanks. Yeah, so I'm, of course, a physiotherapist. I'm an assistant professor at McMaster University in the School of Rehabilitation Science and have my program of research in cancer rehabilitation, implementation science, and health equity. So my week includes lots of research, which consists of working with students in our McMaster Oncology Rehab Lab, teaching in the physiotherapy program at McMaster, specifically in the problem-based tutorial courses mostly, and doing some work with the Oncology division of the CPA. So it's been really great to be able to work with the Oncology division team on promoting cancer physiotherapy across Canada.
I'm Holly. I'm of course, a physiotherapist, also a PhD candidate. So at McMaster University, I work under the supervision of the wonderful Dr. Jenna Smith-Turchyn, who we have here with us. So as a PhD candidate, I get to do lots of research. My kind of like typical week varies depending on kind of what projects I'm working on. And then since I'm doing that full time, I get to practice part time in my local community where I live out in Beamsville. So I'm out there, I work in just a private practice, which is nice because I get to see a variety of things. And I've kind of built up like a small oncology physiotherapy caseload, which is wonderful. So my typical week varies. I also get to teach. I'm assistant clinical professor part-time at McMaster. So I help mostly with the clinical labs and have some different roles, but the typical week kind of varies. It's been so much fun to have all these different roles in these different projects that we're working on.
Both of you are involved with the Oncology division at the Canadian Physiotherapy Association. Briefly introduce to those who aren't familiar with the division, what does the division do?
I can start. So I help with the communications for the division, mostly like social media, helping more with the newsletter. And really, I think what we aim to do is educate physios as well as the general public about the essential role of cancer rehabilitation. We really want to advocate, collaborate, improve awareness and accessibility. And we're co-chaired by the wonderful Dr. Jenna Smith-Turchyn and Alex Grant. So I'll let her share some more.
Yeah, so the goal of the Oncology division is really to bring together, as Holly mentioned, physiotherapists practicing or interested in oncology physiotherapy across Canada. So the mission of the division is really to promote and advance the practice of physiotherapy for cancer patients and survivors by promoting ongoing evidence-based education, facilitating the interprofessional collaborations, and fostering the exchange of both clinical and research knowledge between its members. And together, we really want to advocate for the role of physiotherapy in oncology care in order to improve the quality of life, independence, and well-being of individuals affected by cancer.
What are some recent projects or things that you're working on with the division?
We have a webinar series that happens throughout the year. It covers different topics, and we have different experts come in and present on those topics. As well, we are creating a mentorship directory, which is pairing physiotherapists with new interest in oncology with more experienced physiotherapists to try to gain some knowledge of the profession in the oncology realm. And then also, we're looking to put together a competency profile for physiotherapists who are practicing in oncology in Canada. So hopefully it'll give a guideline to physiotherapists on some different educational sessions they can take part in order to progress through their knowledge and improve or maximize their skills in relation to practicing in oncology in Canada.
That's great. Maybe we can link some of the links if audience are interested in listening to a webinar or joining the oncology division in the show notes. Why are you both interested, passionate about oncology rehab?
So I think, many of us have a personal connection to cancer, which has helped us see the gap in need for rehab services during and after cancer treatment. I mean, this is true for me as well. There's such great resources and treatment for medical management in Canada, but the gap from a rehab perspective has been evident. And as a practicing clinician as well, I'd see people come into the clinic years after treatment had ended with impairments because of their cancer treatments. So for example, things like shoulder range of motion limitations, shoulder pain, decreased strength overall, that I, as a physiotherapist, know that we can help manage or even could have helped prevent if we would have been involved. But no one had ever told them about the role of PT in improving some of these impairments or about rehab and the need to take part in rehab during or after care. So really, I want to encourage this as a part of a standard care for cancer treatment because I know that we as physiotherapists can really help maintain function during treatment, help individuals with cancer maintain and get back to meaningful activities at home and at work more quickly after treatments have ended. So this is one of the reasons why I'm so passionate about oncology physiotherapy. I want to help improve outcomes for individuals with cancer.
And echo exactly what Jenna said, definitely the personal connection at home and was like the driving force into me getting involved in oncology physiotherapy. And one thing that I just truly love about this population is you really make a meaningful difference in the lives of individuals living with and beyond cancer, especially because it's during one of their most challenging times of their lives. And I love that it's not always just about improving that physical outcomes. You're also there to support the mental and emotional well-being. And just to help someone gain back their independence, cope with those challenges, and maintain that sense of control when everything is changing around them, it's just incredibly rewarding. And I love that the field is so constantly evolving. And there's so many new research and protocols and things coming out all the time. So it's just an opportunity for continuous learning to make a lasting impact on patient outcomes. So incredibly lucky to be in this field.
So you briefly mentioned those two groups, people living with cancer and living beyond cancer. Maybe we can do a little bit of differentiation between them and may set the stage of what is the role of physio to play in these two groups of people?
There's a role for physiotherapists in all stages of the cancer trajectory. So physiotherapy helps manage, again, patient side effects, maintain function, improve quality of life, and promote healthy behaviors overall, both during and after cancer treatment. Of course, every individual's cancer experience is quite unique, even if they have the same type of cancer receiving the same treatments. How an individual responds to cancer and its treatments is going to be quite unique. So physiotherapists should always have a tailored approach based on that. But physiotherapists can provide exercise programs that are, again, suited or tailored to an individual's needs, both during and after treatments. They can use manual therapy techniques to maximize joint movement post-surgery, for example, help prevent things like lymphedema. And, physiotherapists really have a role in what we call prospective surveillance. So physiotherapists can help to identify pre-morbid conditions and monitor impairments across the trajectory. So both before cancer treatments, during and after cancer treatments, which really helps to detect issues early and improve outcomes. Overall, there really, I think, is a role at all stages. Again, that like preventative, that prehab, during treatment, after treatment, inter-survivorship care. Again, but really it's about the individual, making sure that they get the right service at the right time that's tailored to their individual needs and their cancer.
Yeah, we'll definitely get into more of the role of physiotherapy in a little more detail after talking about some of the experiences that people have for people living with or beyond cancer. You talked a little bit about people having the individual experience. Everyone's experience is different. But for those who may not have personal connections with people living with cancer, it's hard to understand. So if you just throw it out there, any stories, anything to start us off about some of the experiences people have?
Nearly 1 in 2 Canadians, I believe the estimate now is, will be diagnosed with cancer throughout their lifetime. So the prevalence is really increasing. But with that, we're also seeing increased survival rates, which is wonderful. So we have lots of personal connections. Me personally, of course, we see grandparents and aunts and uncles. But what really hit home closer for me was my youngest sister. She was diagnosed with stage 4 Hodgkin's lymphoma when she was 16. Of course, I had known about cancer and with this, my grandparents go through it, but seeing a 16-year-old go through it was very eye-opening. And it just goes to show how different everybody experiences cancer and that psychosocial effects as well. Someone who's 16 is at a very different stage in their life as someone who's 80. So being able to see their journey, and thankfully, my sister, she's in remission now, she's doing much better, but seeing her journey as a 16-year-old and the hospital where she was receiving treatment was very great. She was under 18. She was in the pediatric center. So they came and they played games with her and trying to make treatment a little bit more fun versus someone who's above 18. They just kind of go into the treatment room, sit down, and they receive their treatment. So just by acknowledging how different everybody and their experience can be, and then really trying to meet them where they're at and knowing that everybody's going to handle it differently.
Thanks, Holly, for sharing that. A lot of time for individuals with cancer, they are diagnosed when they feel quite healthy. Like they feel pretty good. Like you find the cancer, it's quite a big surprise. And then you go through the treatments, and that's really what makes them feel less well than they were before, right? So it's a big change. And there's a lot of that affect you psychosocially as well that together can be a lot to handle. So it's about thinking about the individual because, again, people who receive the same treatment for the same type of cancer can have a quite different experience.
Yeah, I think it's important to highlight the biopsychosocial, perhaps spiritual nature of battling with cancer. The rehab doesn't stop when you have your cancer in remission. It kind of goes into a lifelong rehab journey. Is that correct?
Yeah.
Oh, yeah. Holly, you were going to say the same thing. I think, yeah, we see sometimes that time after cancer treatments have ended as like being the most difficult for people because they don't have that connection anymore with the cancer center. But now, like they're left, they have all these side effects. They're kind of left hanging, and cancer's not over when treatments are over. Like the side effects, people are surviving cancer for decades after treatments have ended. And a lot of the time, side effects like lymphedema, restrictions in strength, range of motion can maybe start early, but maybe not start until later and like just, maybe progress after treatment as well. So definitely not something that ends when treatments have ended. And again, physio and rehab has a big role to play in it post-treatment as well in terms of survivorship care.
Continuing along the lines of lived experiences for people living with or beyond cancer, I'm interested in touching a little bit about pain. So, how many people with cancer in remission live with pain?
Pain is one of the most common symptoms in individuals with cancer. There is a little bit of variability in the literature in terms of the percentage, but around 20 to 50% of patients with cancer, are living with pain. And pain, again, has a negative impact on their functional status and quality of life. Those who are in pain, can't sleep as well, don't move as much. And that leads to a cascade of effects that, again, really limits function and quality of life. So really important to consider this as a physiotherapy at all stages of cancer, assess for it, ask about it, right? And physios definitely have a role in terms of managing pain for individuals with cancer. So it's really important thing to ask about for as physiotherapists.
Just a curious question. Where does the pain typically come from? Is it from the disease itself, treatments, surgery, medication?
It can be all of the above, and it's different for every individual. Often we see in those with early stage cancer, so we say stage 1 to 3 for solid tumors, that the pain is often actually associated with the treatments received as opposed to actually the primary tumor, where the literature says it's a little bit different for those with more advanced disease, where it's actually the primary tumor that can cause pain a little bit more. But in terms of the early stage cancers, again, things like surgery, radiation, chemotherapy, and targeted therapy can cause pain. So thinking, for example, about surgery. Of course, it's of primary importance to take out the tumor and any tissue surrounding the tumor that may contain the cancer. But with that, of course, the surgery is going to affect a lot of the surrounding tissues. So it can cause limitations in muscle and joint function, which increases pain, again, outside of that primary tumor itself. Chemotherapy, of course, there's many different types of chemotherapy. It's chosen based on the cancer type and the specific characteristics of the cancer, but it often leads to muscle and bone pain. Individuals with cancers like breast cancer, prostate cancer are often on hormonal therapy after chemotherapy, radiation have ended some of those more common therapies. And that is characterized by joint pain. Joint pain is often listed as one of the most common side effects for individuals on hormonal therapy. So, individuals may be trying to move, maintain their function, their usual activities, but if this leads to pain, they're going to stop doing that, right? And this lack of movement causes other issues to present themselves. So it's like that cyclical process. So pain can be kind of the catalyst for other impairments as well. And then you read about in the literature things like nerve pain, phantom pain, that can all happen during cancer treatment. So as a clinician working with this population, you'll hear about all kinds of different pains that can be caused by the treatments as opposed to the cancer itself.
When I was looking at Cancer Care Ontario and some of their statistics, most cancer treatment-related pain is neuropathic in origin or like nerve-related, mostly as a result of treatment, especially with chemotherapy. And then therefore they have to take some kind of like pain adjuvant and approach to treatment and how can we address that neuropathic pain. So just being aware that there's, of course, pain from the cancer itself, especially as Jenna mentioned, maybe in more of the advanced cancers, especially with maybe like bone metastasis. We can see a lot of pain from that, pain from the treatments, especially chemotherapy, radiation surgery, like Jenna mentioned, and then just be considerate of maybe what could be causing the pain. And that can kind of course, guide how you treat it.
In terms of pain levels across the stage of cancer or even beyond, is there any correlation between levels of pain and the advancement of cancer or not really?
It's really individual.
So Jenna, you mentioned a bit about it's important for physios to ask about and assess pain for these individuals. What would the role of physiotherapy play having assessed the pain? Are we applying things to help with the pain or having the pain inform how we go about treatment?
I think it could be a little bit of both. Of course, you want to do like a very comprehensive assessment, and you're going to be hopefully it's working with the multidisciplinary team. So everybody's going to take a part on how they can best manage pain, but definitely do a nice comprehensive assessment and factor how to best go about addressing that pain, whether it's mostly pharmacological at the time, or hey, is there more of a role for non-pharmacological right now? And then how can we step in association with everybody else in order to address that pain? And then kind of knowing, is it more acute pain? Are we talking more chronic pain? Are we thinking like the breakthrough pain? It occurs when you're having your like regular dose. And typically we see it when the effects of the pain medicine starts to wear off, but you can have kind of breakthrough pain kind of spontaneously. So knowing, okay, what kind of pain is it and how can we best kind of manage it together?
Maybe we can dive a little bit the role of physiotherapy perhaps in different contexts, because I imagine if it's outpatient versus inpatient, acute care versus rehab, there would be a little bit of a different role. Briefly run through what that looks like.
Yeah, definitely. So also depends on what hospitals you're working at, the locations. Maybe a small local hospital won't have as much resources as Princess Margaret. But if you're maybe more post-surgical, you're seeing people post-surgery versus more rehab, knowing if we're still in hospital, how are we going to get that person home? What makes them safe to get home? Kind of traditional physiotherapy, but just within the context of oncology and to more of an outpatient. And that's where I think I can spend most of my time talking about as I work outpatient now is I find mostly it's tough because you can see people if maybe they heard about you, maybe they're still receiving treatment, but I will often see people who've had cancer years ago and maybe they have something else, but you still need to factor what treatments they had into that care if it's relevant, especially if we see potentially more like breast cancer patients and someone had a mastectomy years ago and maybe they have a shoulder rotator cuff tear now. Well, that mastectomy and that breast cancer history will be very relevant for you in terms of your treatment. So just being able to make sure wherever you are, you're taking your thorough history, your subjective, and then you're using the tools that you have in your toolbox to treat it.
So since you have a bit more experience or expertise in the outpatient setting, how would physiotherapy complement the interdisciplinary management of cancer and or pain?
I find it really depends also what stage that person's in, if they're receiving treatment, out of treatment. If they're in treatment, I often send or fax something to the oncologist. And so that way the oncologist kind of knows you and you can say, like, hey, I'm Holly, I'm the physiotherapist who's been working with whoever, and I'm seeing them. This is what my plan is. Is there any kind of precautions or considerations you have for physiotherapy? Is there anything you want done? And kind of make that connection that way, because not all hospitals or treatment centers will have a physiotherapist on staff. So that person is showing great initiative and coming to see you. So always having that communication with the oncologist is great. If they're now past treatment and they're living beyond cancer, you'll definitely just want to consider their health history. Okay, when was that cancer? How long ago? How long was your treatment? What kind of treatment did you receive? If you can know a little bit about the drugs as well, that can just kind of inform, well, are we thinking maybe more neuropathy, or is there anything else we should factor in, just to kind of inform your treatment plan, but still maintaining communication with their care team if they are being followed still by the cancer center is always good to do, because then you're just having that communication with the oncologist will also just strengthen that relationship with the patient themselves and give them a little bit more support and reassurance that my oncologist, my care team, everybody's on the same page.
Yeah, now along the lines again, pain management side of things, I understand that managing expectation is important because perhaps cancer-related pain isn't something that will fully go away. Maybe yes or no, you can tell me if that's true, and how do we manage that expectation?
It's all about education, right? And educating and informing individuals with cancer, their families, their caregivers about, what's happening, why it might be happening, and what are some strategies that, you could implement yourself as a physiotherapist, but again, as part of that larger care team in terms of managing the pain and talking about prognosis as well. I think, again, it's very different for each individual. It's definitely something that can be mitigated. Pain can go away post-cancer treatment. Some people have it for a short period of time. Some people have it for a longer period of time. So again, it's taking the individual's history into account, their treatments, their cancer type, and I think having that discussion with them and with their other care providers at different points throughout care.
What are some strategies or treatments specifically in physiotherapy that can be used for cancer-related pain management?
There was a systematic review and meta-analysis published a few years ago that found that there was quite strong evidence on the effectiveness of various physiotherapy approaches for cancer-related pain management, mostly related to the benefits of exercise. So both aerobic and resistant exercise in terms of managing cancer-related pain. But there's also been evidence that has come forward for high-intensity interval training, which is another type of exercise, but myofascial release as well, which is a physiotherapy technique we can use. There's been literature that's brought forward on the use of acupuncture for those who are rostered in terms of providing acupuncture for some of that neuropathic pain that Holly talked about a little while ago. And then you'll read a lot about all of those other physiotherapy techniques we use, like physiotherapy for chronic pain and musculoskeletal or orthopedic physiotherapy, like mobilization, both of the joints and nerve mobilization as well. Thinking about other massage techniques as well, the use of TENS, biofeedback, motor imagery, motor mirror therapy. Some of those techniques we use in other populations can be used in individuals with the current or past diagnosis of cancer as well to manage pain. So in terms of guiding what you're going to do, you need to think about, again, the mechanism of the pain and, what could be causing pain for that individual patient. We have really strong evidence, again, for the use of exercise to manage pain and emerging evidence for some of those other techniques that I just described.
Yeah, it's very encouraging to hear that a lot of physiotherapy management techniques can be helpful for managing cancer-related pain. I also briefly came across another systematic review about mind-body techniques for managing cancer-related pain. One of you can talk a little bit about what kind of mind-body techniques have the research found to be helpful.
I can speak a little bit about this. I don't know exactly the whole literature. I haven't done a big review on it, but I know a lot has gone into mindfulness exercises and how those can kind of help with pain. Mindfulness, I'd say, also helps with that biopsychosocial approach and thinking holistically about the person and being able to take a minute or something and work through different mindfulness techniques. I find that can be great for patients, as well as I use sometimes body scans in my practice. So just having them to do like visualization and different things like that, it can just help take a second and just kind of slow their mind and start to work on other things. So definitely those areas of practice. I'm excited to see where the research kind of continues to go. And just I think like the more education we can give people and just other things to try. A mindfulness exercise might not work for one person, but it might be amazing for somebody else. So just trying different things, I think, is the biggest thing.
And when I was doing my internship at the cancer hospital in Toronto, we had a music therapist.
Hmm.
And what I read from the evidence-based recommendations, music therapy do play a big role in managing or strategies dealing with cancer.
I don't think it's one of those things that is a standard of care either and not available at any center. So really lucky if you have those services available at the center that you're at. But there's lots of options that have a lot of potential. And it's about, again, thinking about the individual, what might work for them, what speaks to them in terms of helping to manage the pain, and then trying to advocate for that service and help them access it.
Well, let's dive into some of the evidence around cancer rehab, which this is the area of expertise for both of you. On a high-level overview, what does the current literature say about evidence-based cancer rehab?
So overall, I'd say the current literature says physiotherapy can be safe and effective for individuals with cancer across the cancer care continuum through all stages. We know exercise specifically is safe and beneficial for individuals with cancer and beyond cancer to perform. We see the exercise kind of recommendations very similar to our Canadian physical activity guidelines, where we want our aerobic activity, we want at least 90 to 150 minutes of aerobic exercise broken into small 30-minute bouts at moderate intensity. We want our strength training that at least 2 days a week, our 2 sets of 8 to 15 reps, all of our major muscle groups. We want our flexibility training. Overall, we know general rule of thumb that it's easy to use in practice is just if someone's safe to receive their chemotherapy or their treatment, they're generally safe to exercise.
Yeah, that's great, Holly. And I think there's great information related to the benefits of exercise for this population. And physiotherapy plays a big role in providing those exercise recommendations. There's been improving knowledge over the last few decades in relation to this, but often you'll still hear people think that they need to rest during cancer treatments. They shouldn't take part in the activities that they used to. But even if you have higher stage cancer, you're at risk for lymphedema, like it's really important to maintain activity levels to maximize your function. There are new guidelines out for exercise for individuals with bone metastases as well, which so that you can still do it, it's still safe. It does require extra precautions, and should be monitored by a physiotherapist or exercise physiologist or someone with advanced training in working with individuals with cancer, but it's still something that physios can prescribe to their patients and encourage. I mentioned it before, but that prospective surveillance model and what we as physiotherapists should assess at what time points is something that is a recommendation I suggest all physiotherapists working with this population to take a look at. It was created related to individuals with breast cancer, but it can be applied in some of those basic principles across cancer types and treatments. So it talks about using different measures of function at different time points across the care trajectory, thinking about things like range of motion, strength testing, when to measure limb volume, pain, fatigue, just general functional performance across time. That's one thing that we as physiotherapists could probably get involved in more, that surveillance of individuals with cancer across time points, and then referring and triaging our specific management strategies based on the individual's outcomes and needs. There has been literature and research done, especially in the US, on using a model like this, and it's been shown to be cost effective as well. So thinking about how we can integrate these services more within our Canadian healthcare system will be really important moving forward. But we know that physiotherapy, to kind of sum it up, has a lot of beneficial effects. So now the focus is on how are we integrating it? How do we actually get it to be a standard of practice to help individuals at different stages of the cancer trajectory?
So where are we at right now then with incorporating this in the Canadian healthcare system?
It's not a standard of care. So people who are going through treatment for cancer are not usually offered physiotherapy services. So there are programs available. There's a lot of exercise programs available. Even in, Hamilton here, we have programs at the YMCA, at specific physiotherapy clinics at different universities that are available for individuals with cancer. And we have these really great recommendations out from leading national and international organizations, which Holly has mentioned. But again, access to these programs and adherence to the recommendations are low. We know that less than 30% of people actually access these services or meeting current exercise guidelines. And when you talk to people about why, there's apprehension because of the side effects that they're experiencing, the pain, the fatigue, different things like that, some of those physical side effects. But there's also a lack of knowledge and education on the benefits, like where do we access these programs, right? There's not a lot of referrals happening in a lot of instances from primary kind of acute healthcare setting where people are being treated to some of these outpatient services or rehab services for a variety of reasons. The cancer centers are so busy. The oncology care teams have a lot on their plates, and there's no real defined rule for who should actually be doing this, discussing it with them, promoting it. So while we know the benefits are great, it's not something that's accessible to most individuals with cancer in Canada. It's also, for those who know about it, it costs money usually to get it, right? To access some of these services. So there's the financial barriers, transportation barriers. And so it's looking at ways that we can try to advocate and integrate it into the healthcare system.
That's unfortunate that people living with cancer or beyond cancer can access physiotherapy. Of course, as physiotherapists, we think this can do good to so many people. So many people can use this. But in terms of how people living with or living beyond cancer perceive the effectiveness of physiotherapy, what are people generally thinking about that?
A little mix of everything. You'll see some people who all do all this education about the benefits of physio and exercise, and they're like, nope, I don't want to do anything. I'm receiving my treatment and I want to sit down. Or we'll see care providers and support systems like families. They'll be like, no, 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 you're in pain. You're receiving your cancer treatment. You sit down and I'll go grab it for you, or I'll bring you your food and you just sit and rest. So it's really focusing on kind of like educating about the benefits of physio and exercise there as well. Lots of different things.
Yeah, and I think there's that lack of knowledge to start in some people. These people come in with various levels of knowledge about the safety, the benefits of it. We have some program, an exercise rehab program going on as part of a research project at some cancer centers across Ontario. And for a lot of individuals, it's kind of like an aha moment when they do start to participate and take part. Like they start to understand a little bit more about the benefits, the physiology behind how the benefits are occurring, and they start to feel better. So it's nice to see that aha moment. In the research we've done on implementing exercise in cancer centers across Ontario, we've had really great outcomes in terms of participants' like perception of their health status. Their quality of life improved significantly. Their functional capacity improved significantly. We know all those benefits are occurring. But we also qualitatively hear that they are surprised about, how it affects them psychosocially as well. So for example, in the study we have going on in cancer centers across Ontario, people will come in and do an exercise and education program with a trainer, either a physiotherapist or kinesiologist, right before receiving treatment, most often chemotherapy, or seeing their oncologist. And they'll come in quite anxious to the appointments because they're worried about the chemotherapy or unsure about how their cancer is progressing, but taking part in the exercise actually helps to calm them down a little bit. They say that, oh, that really helped me. I feel better now. They feel more ready to go up and receive that treatment. So it's almost about empowering, like these participants are seeing that they have the physical capability to do something. It does empower them a little bit, which helps them get through treatment. So I think, although there may be some initial apprehension, as Holly has mentioned, if they have the chance to be educated, engage with a physiotherapist or a kinesiologist, and see and feel the benefits, and it really does change that. They have that aha moment. It empowers them to continue with it during and after treatment.
Never thought about that empowerment aspect. That's very important and interesting to hear.
Cancer is one of those things where you don't have a lot of control over what's going on a lot of the time, right? But your physical activity level, your ability to take part in things do have control on that. And so seeing that you can do it, it gives that sense that you can control something, like, you're able to do something throughout that time where there's a lot of uncertainty, right? And unknown some of the times.
So I'm wondering, on a practical level, what are some tips for physiotherapists or kinesiologists to do that education? Because we know a lot of times people are like, yeah, exercise is important. No, I don't want to do it. Like, what are effective strategies in the healthcare professional perspective to change behaviors and change attitudes about exercise?
One of the things I've found is that it's really important to talk about what exercise is with people, right? Because exercise can be scary for a lot of people who haven't exercised before. They think that means you got to go to the gym and become like a bodybuilder, right? But make sure that they know what you mean and that, like, walking at a moderate intensity is a form of exercise. And I think we do a lot of goal setting and action planning in our programs as well. And that initial goal and action plan shouldn't be for all individuals to get to that exercise guideline by the end of 2 weeks, right? It's about slow, steady progress in order to help achieve an overall goal, which is maybe meeting those exercise guidelines. But that might take months to reach. The first goal over 2 weeks might be to get a new pair of running shoes, to clean off the exercise bike that's sitting in your basement with things all over it, right? And then it might be just walking 5 minutes twice a week to start. You're going to slowly progress. So I think that's really important for healthcare professionals to think about where an individual is coming from, describing what exercise is, and then setting realistic goals related to physical activity exercise with the individual. So that's one thing. I think the things we've already talked about, remembering that not every patient is the same, considering their emotional state as well as their physical state is really important.
The biggest thing there is also listening when you're providing your education and making sure that they feel heard. And that way, when you're educating them, especially about exercise, it doesn't just go in one ear and out the other. And just as Jenna said, exercise can be very scary, or they think, okay, I've got to be a bodybuilder to exercise. And exercise can just be going up and down the stairs or go check your mailbox or small little things. And like Jenna said, setting those goals and those action plans, no matter how big or how small they are, every little bit counts. And then meeting them where they're at and just taking it one step at a time and just not giving up, especially if, like I mentioned earlier, somebody was like, nope, I don't want to do that. I'm receiving cancer, like leave me alone. Totally respect that and just kind of continue your education over time, as it can take a little bit in order to have that be heard and understood and have someone be ready to change or to do a behavior or things like that. If we think about all those behavior change principles and things like that, just giving people the opportunity, the time to process the information, you supplement them and guiding them as best as you can in what works for them.
Thanks for those tips. How do you work with fatigue? I know in the journey of dealing with cancer, fatigue is a big aspect and low energy and all that. How do you balance that and telling people that exercise could help with your fatigue too?
Yeah, it's one of those things that requires a lot of education because it seems contradictory at first in that you're feeling tired, but if you exercise, it's going to help it, right? So they think exercise is going to make them more tired, but it's about educating about why the fatigue is happening, how exercise works, and how it might overcome it. And then I think, again, setting those small, realistic goals, saying that, yeah, eventually we want you to exercise maybe half hour, 5 days a week or something like that, but you can do 10-minute walk in the morning, 10-minute lunch, 10-minute after. So breaking it up into more manageable bouts for the individual, thinking about their fatigue, how they're feeling, their lifestyle, if they have to work, when does it actually fit in their day, things like that. A lot of people have families, things like that. Just taking all of those things into consideration and helping it fit into their daily life, I think is really important and can definitely help integrate it for someone who has experienced fatigue, which is a very common side effect of cancer treatments.
Just to add, I've seen some research go out into like active rest breaks and the importance of taking maybe just 10 minutes and just laying down completely flat and taking a minute to kind of reset, but then kind of continuing on throughout your day, but just giving you the time and the space to acknowledge the fatigue and just go lay down for just 10 minutes, short little breaks, and then get up and keep going. But fatigue, it's just very prevalent in individuals living with and beyond cancer. So just finding ways and strategies you can help manage fatigue. And as Jenna said, that education piece is so critical.
We've talked high level what exercise is evidence-based, highly recommended, very beneficial for the bio, but also the psychological and social aspects of people living with cancer and beyond cancer. I wonder if there are any stories you can tell to illustrate how exercise has played a role in someone's journey with cancer.
I don't know if there's one specific one. I think we've just seen so many times over and over people who, maybe come in with really low activity level, like doing nothing. They start to do very small bouts, see how it's benefiting them. They develop kind of during and after cancer, like a whole new outlook on physical activity. They develop a whole new social network too around physical activity and exercise. I think just that education during, having accessible programming during is really important in order to educate individuals living with or post-cancer on the benefits of exercise, how to exercise safely, and how to fit it into their daily lives. And then it just becomes a habit, right? Something that they incorporate and do naturally without needing that one-on-one guidance.
Definitely lots of stories. Everybody I find is so different on their exercise journey. And it's been amazing to see, as Jenna said, maybe someone starting with zero exercise and eventually they're getting up to 30 minutes of exercise. Personally, I have a patient right now who I see her one goal was to like get back into baking. So then we would make kind of like exercise programs and things based towards baking. So we'd work on like going our standing tolerance, our balance, and you had to do some whisking. You had to bend down to put your cookies into the oven. Just really making it exercise focused, but make it tailored based on the individual and their goals. So that way it makes it fun. And that way they can get involved a little bit more and it doesn't feel like exercise. My sister personally, pets and companions are great motivators. Our family dog at the time was a great source of motivation for her to come and cuddle up, and just the opportunity for her to just go outside and throw the ball for the dog and just things like that. Take it for a small little walk. Those can be great tools and resources as well. I know Jenna does a lot with peer support for individuals with cancer and how peer support, having somebody be there with you, and or if they've also experienced cancer, that can just be a great tool and resource as well for helping people get going with exercise. And we've seen great success stories with that as well.
That's great. I think what the two individuals you've highlighted, Holly, there is to illustrate not just exercise for the sake of exercise or the sake of benefits of the exercise, but it's doing what you want to do in life. It's baking, walking the dog, and picking up your grandchildren if that's what you want to do. Like these are ultimately the goals we hope we can help individuals to achieve. Not just like, hey, this exercise is good, do it. So that's important. Yeah, so in terms of the evidence for peers support group or the experiences people have in these groups, maybe share a little bit of that.
Yeah, so some of the work I've been doing over the last few years with colleagues at University of Toronto in the Faculty of Kinesiology and Physical Education has looked at the use of partner-based peer support for individuals with cancers. My creative colleagues at U of T created this system called Active Match, and it's kind of like a dating app, but for cancer survivors to find an exercise partner. So they go in, answer a few questions about themselves, and it matches them up. So that's a great program for anyone looking for an exercise partner. But we did some research on the effectiveness of being paired with a partner, as well as, and they're supporting each other across the treatment trajectory, compared to being paired with a partner, but also receiving qualified exercise professional support once a week for a duration of time, so 8 to 12 weeks. And we found benefits in both groups, so that ability to just have a peer who has been through a similar situation to yourself. We try to match the individuals based on their cancer and patient-specific characteristics, but it does have benefits, even just being able to share your experience with someone else, having someone else that you're accountable to in terms of physical activity and exercise, in terms of achieving your goals, providing suggestions on what's worked for them. So that peer support does provide a unique form of support compared to exercise professional support alone or health professional support alone. And we know that there's lots of individuals who have had cancer who are out there. It could be a cost-effective strategy, right? Just to have that peer support in place to try to encourage healthy behaviors like physical activity. So that's one thing out there. And then, of course, yeah, the social aspect of a lot of the groups that are out there, the physical activity groups, is another way that you can link in with members of your community who have also had cancer. And there's different strategies you can use. Again, as an individual, what do you think is going to work for you? Or as a health provider, a physiotherapist, what do you think is going to work for this patient? And just being able to provide them with some supports that are available that may suit their needs.
Her work has been amazing to see and to be a part of. And I know there's starting to be more and more things, especially with the Canadian Cancer Society, or the Adolescent and Young Adult Cancer Society. In Canada, they have great programs too to try and connect young people all across Canada. So there's so many great resources out there, whether it be a Facebook group, whether it be something at your local YMCA. But just highly recommend to take part or to try to get involved, or to even just to know what's out there. So that way, if a patient comes in and is looking for that, you have those resources that you can share, because Jenna mentioned, it can be just highly valuable to just have that one person or have somebody else be able to share an experience with and hold you accountable, keep you motivated, especially when it comes to exercise.
Yeah, it's important to highlight if you are working in this area, or even if you're not an oncology physiotherapist per se, you might have encountered someone with living beyond cancer, and just knowing that these resources exist and be able to provide that. And perhaps we can link a few in the show notes as well for people who can look it up and get familiar with what are available out there. We talked a lot about what are important for physios to be doing. What are some things that physiotherapists shouldn't do when working with people with cancer?
Great question. I was trying to think of some like do's and don'ts, and a lot of the don'ts can also be do's, but I have don't be afraid to ask for help. All guidelines, whether it be provincial, national, international, all recommend a multidisciplinary approach. So if you're ever stuck, don't be afraid to ask for help. And don't forget about the basics. Take that good subjective. Do your active listening. Listening is such a valuable skill in this patient population. Don't forget about things like your basic objective, your range of motion, your muscle length tests. Look for your skin changes, swelling. All those kind of things are very valuable to inform your treatment plans. Don't push too much. And of course, we want to encourage people to exercise and be physically active and work through physiotherapy treatment, whether it be manual therapy, acupuncture, anything really. But I find depending on who you're working with, more is not always better. And I feel like that's the case across all physiotherapy. So just be aware to take things slow and kind of progress over time. Just look at your patient. You've done your nice subjective, you've done your objective, you know what to do. Take things slow, progress over time, and don't be afraid to ask for help.
Is it important for physios working with people with cancer or beyond cancer to stay up to date with evidence? And if so, how do we do that?
Yeah, it's definitely important for all physiotherapists to stay up to date on the evidence for the area of practice that they're in. In terms of oncology and physiotherapy, the oncology division is a great place to go for this. So we have regular webinars that provide up-to-date evidence on specific topics related to oncology physiotherapy. We have monthly e-blasts that go out that do highlight some of the new evidence that's out there. Great social media, which Holly does help with, that does link to some of the latest evidence that comes out related to physiotherapy oncology. Also, the website is a great resource on some of our past educational offerings. For members, you can go back and look back on some of the webinars and e-blasts from the past year. And then just collaborating with other people, going to those conferences, learning about the role of physiotherapy in oncology, talking to people who practice in that area are all great ways to stay up to date on current practices, as well as reading the literature as it does come out.
Yeah, just can't boast enough about the role of divisions for physiotherapists. We do try so hard to put that out there, provide that sort of knowledge translation for people out there. And just a little plug for Pain Science Division too. We have regular offerings, the community of practice that we have. So even your oncology physiotherapy, knowing pain science can really help a lot for people who are living with pain. So earlier in the interview, we talked about how people may not be aware of the role of physiotherapy to play. Then it kind of gets into the area of advocacy, advocating for the role of physiotherapy in cancer rehabilitation. Is the oncology division playing a role in physiotherapy advocacy, and where are we at in this area right now?
It's definitely one of the main roles of the oncology division as well. We have a new advocacy rep, which is very exciting. It's about collecting the data so that we have good data that we can use to advocate with, so that not only, again, the benefit of physiotherapy services, but the cost effectiveness data is needed and the data on patient acceptability. And we have to take that data to other physiotherapists, to the patients, to other health professionals, and then to the health administrators and policymakers. Canadian Cancer Society is a great supporter, but thinking about it on a provincial level in terms of health service provision is something that the oncology division researchers like Holly and myself are trying to do. One of the things that I think is most powerful in terms of advocacy is the patient voice. So I think it's really important to develop partnerships with other end users, such as other healthcare professionals, oncologists, patients, and having the patients use their voices to tell their stories about how it's benefited them during and after cancer treatment, which will hopefully help our services become more integrated into the current healthcare system for this population.
Yeah, the division, it's exciting to have our new advocacy rep and doing even things like this, getting to collaborate with you. I think it's exciting to see, and I'm excited to see where the future takes oncology physiotherapy.
Having the data to support the efficacy of physiotherapy is important. Apart from research in that aspect, what are some gaps in our knowledge about cancer rehab? And what are some questions that you're looking at right now?
I can speak to some of the things that I'm looking at, and it tied into what Jenna was talking about earlier, especially with the prospective surveillance model. When should we assess and interfere, like intervene and administer treatments and things like that? And what I'm looking at specifically is the role of a physiotherapy navigator. And we're going to trial this at the local hospital in Hamilton. So when people are newly diagnosed with cancer, the physio navigator is going to meet them and they're going to follow them along their care plan. And we're going to look to see with routine and ongoing assessments and then potentially early intervention or just monitoring. Can we look to reduce side effects long term and over the course of treatment? So really advocating for the role of physiotherapy to be included across the whole cancer care continuum, from diagnosis into treatment, late treatment into survivorship. So I'm very excited to see where that takes us. It'll be the first one trialed in Canada. As Jenna mentioned, there's some being done in the States right now, but it'll be nice to do here. And we hope to kind of extrapolate it if we get some good results across Canada.
No, I think that's a very exciting project that Holly's leading on an emerging role that physiotherapists could take in cancer care settings. And I think in terms of the gaps, like we know it's great, but the main question now is how do we implement it? Like, how do we actually implement it effectively? So we're conducting those implementation effectiveness trials. So that's, I think, of primary importance. The cost effectiveness analysis. We have lots of data on that. My goal in 2025 is to analyze that cost effectiveness data, get that out there to help advocate. That's a current gap. We have a little bit of data on it, but we need more. And then I think we need to think about technology. How do we use this technology, AI, some of this new technology to help people self-monitor, self-manage at home? The healthcare system can only do so much. A part of our, I think, role of physiotherapist is providing individual strategies as well to be able to monitor and manage at home, kind of identify when something is not going well and seek physiotherapy, rehabilitation help as soon as possible to catch these things quickly and prevent and manage them before they get too bad and cause too much issue for the individual and the healthcare system. How to triage based on need, different referral strategies. There's a whole bunch of things we need, but I think it all can be summarized under the umbrella of how are we actually implement this and doing this. We know it's beneficial. How do we put it into practice?
I see, I see. Okay, well, all the best with the analyzing the data. I know it's a lot of data to look at and sort through. Good stuff. Okay, so coming to the end of the interview, any concluding thoughts before we end?
Physiotherapists are such important professionals in the care of individuals with cancer because of things like pain that are so common, fatigue that are so common. More people are surviving cancer, luckily. So there is going to be an increased need for this as the years move forward. So to just get out there, learn about it, talk with the individuals you're working with who have had cancer, educate them on the benefits of physiotherapy, rehabilitation, exercise, and try to help advocate for the profession in terms of managing individuals who have a current or past diagnosis of cancer.
I totally agree. Physiotherapists are in a great spot, great profession to take on some of these roles. And I'm excited to kind of see where the future will take us. But definitely stay curious, try and find ways if you want to get involved with the division or follow us and stay in touch with like resources, look for opportunities to collaborate. That's why it's so wonderful that we're able to come on and collaborate the pain science division as yes, it's cancer, but it encompasses also so many other things and pain being very prevalent, as Jenna said. So just being able to stay curious, keep looking, and physios are in such a great spot. So just very excited to see where the future takes us.
Wonderful. Good concluding thoughts. Thank you so much for both of your time coming on and collaborating with us.
Thanks, Tiffany. This is a great podcast you're running. I appreciate all your support.
Thank you for listening to this episode on oncology physiotherapy. If you want to learn more about this topic, we've included resources in the show notes. Paincast is a freely available resource for you to advance your knowledge about pain and physiotherapy. We will continue to provide you with top-notch, evidence-based, and practically oriented content. To help more people know about this amazing resource, follow us, rate us, and share our content with your network. Follow us on Instagram at paincast.psd, where you'll find bite-sized knowledge in 1 to 2 minutes. You can also use the feedback form linked in the show notes to help us improve. Thank you again, and stay tuned for future episodes on pain and physiotherapy.